An audio coming in, we could listen to it before we read others. Yes, please.
Good evening. For me, I want to ask, like, my brother has a problem. Like, they say that we went to the hospital, then they say that it came from a young age. But like, his penis itches him a lot, and sometimes it swells a lot. It swells.
She's saying she has a brother.
Yes.
And I think he was
She has
examined.
a problem with his penis, and it swells and itches.
And itches a lot.
And from the hospital, they said he got
started
the problem
right
from
childhood.
From childhood.
Yes, yes.
Yeah.
Mm.
So I don't know what type of doctor he visited, but this is a case which has to be handled by a urologist.
Okay.
It is true there are some problems of the penis which people are born with, and it can present in any form. Sometimes this presents with the deformities of the penis, or maybe the opening on the penis is on the wrong side. Sometimes it bends the penis, and it sometimes can be associated with the itching because of the wrong disposal of the urine.
Okay.
Yeah, so this needs to be evaluated by a doctor called urologist who is specialized in that area.
In that department.
Yeah.
Thank you so much,
So
doctor.
that needs to be evaluated to find out the exact cause. But there are usually solutions to that. If it is something the person he was born with, it can be corrected.
Okay.
It can be corrected.
Thank you so much, doctor, for that response. We have many other messages here. My son's testicle on the left side. There's someone who called. Yes, I think Richard.
Yes, Richard called
yeah,
about.
we could. Yes, let's first start with Richard.
Yeah.
He's saying when he's meeting the wife. Yesterday,
they get bleeding.
Yes, the lady bled, and every time they're meeting, she gets pain. Yes, what could it be?
So that bleeding during intercourse, especially if it's a regular occurrence, should not be taken lightly. It may have a lot of implication on the health of the woman, especially. But this is associated with the pain. So we have to evaluate also whether the lady has other issues within her system. Okay. Yeah. So, but definitely for the sake of the health of the woman, Richard, you have to take that lady for evaluation. She may not be telling you the details of her health, but she will be able to tell the doctor, and they can be able to examine and help her.
I know sometimes we women, we keep a lot of secrets.
Yes.
Someone struggles with infertility, yet years back we carried out a lot of funny practices, but we are unable to open up. Yeah. Yes, okay. But in case she opens up, at least to a doctor, that will help them.
Yes, she definitely needs to be evaluated.
Thank you.
Yeah.
Thank you so much. We still have many questions here, doctor. This one is saying, my son's testicles on the left side is swollen, but can it cause infertility if it's 10 years now? For now, I think it's 10 years. Yes, and one side is swollen.
Swelling of the testicle, especially if it is painful, may be a sign of infection. And these are some of the things which can lead to infertility in future. Okay. Because infection which disturbs one testicle can actually disturb the other testicle, either directly by the infection going there, or indirectly by triggering the body to destroy the testis.
True.
It will destroy the infected testis, and it will also destroy the other testis. So this is something which needs to be attended to, definitely.
He's 55 years old, and he doesn't erect for the past 3 to 5 years almost. Yes, what could be the problem?
Yes, so he's 55.
55.
Well, yes, so usually erection issues can occur between the ages of 35 to like 60 years there, and there are different causes of this. Yes, they could be psychological, they could be hormone related, yes, or there could be some other issues like diabetes, or high blood pressure.
Okay.
Yes. So all that needs to be evaluated, and we need to find out exactly what the cause is. Yes, even if it is related to the age, there are treatments available. It can be sorted out.
Okay.
Yeah, the longer you spend without having the problem corrected, the more difficult it gets. So I would advise him to seek help immediately, so that the issue is sorted.
Then, hello, I've watched the second time now. I was operated of a baby in 23, ceased to have periods. Can I be helped? What's the address? Please, longing for help. Rachel. She, I think, stopped her menstruation some years back when after some operation in 2003. And she's saying she really needs help, and she's looking, I think, for, she's looking to meet, I think, you. Yes, Rich, I think you can come to Bethany Women's Hospital, Luzira, depending on where you're from. Luzira is the main branch. There is also Entebbe Road branch. You can come to Bethany Hospital. You can't fail to get help, I'm sure. Thank you so much, Rachel. Good evening, doctor. My question is, does hernia affect the growth of the penis, and does it affect infertility in men? Yeah, so hernia is a swelling of contents from inside the abdomen, which goes through some hole, and in most cases it ends up in the scrotum. Okay. Yeah, so things are protruding through some spaces of the muscle and coming out. Now, unfortunately, these spaces are shared usually with the tubes of the sperm as well. Okay. Yes, and also the blood supply. Now, when they're doing surgery for these hernias, sometimes they can tamper with the blood supply of the testicle, and so in some cases, not common, you can have issues with your fertility following hernia surgery. Usually it's not before the surgery, no. It is usually after the surgery, especially if the surgery is not done by somebody who really knows hernia surgery very well. Yeah, you know, people usually take hernia surgery very easily, lightly. It's not. It has a very complex anatomy. You can actually interfere with somebody's fertility if you don't do it well. Thank you so much. Yeah. And this is Daniel. Does Bethany Hospital treat infertility in men? Oh yeah, we treat the whole infertility. Okay. Yeah, so both men and women. Yeah, we do. Thank you. Hello, Doctor. Medical Minds. Thanks for the presentation. What could lead to the conditions where passing urine doesn't come out all, breaking towards? I think he didn't type it well. Come out at once. Yes, doesn't come out at once. Does it have a solution? I think that is something you've been explaining. Yes. So that intermittent passage of the urine signifies most likely a problem of the passage. Either the prostate is enlarged, it is squeezing up there, or the urethra has scars down, maybe due to infections, and so the passage is narrow and it has to be forced through. So that is somebody who needs that evaluated properly. If he's above 35, it will be an issue of prostate. Okay. Yes. Okay, thank you. And then we are running out. I think we have some 3 questions which we didn't attend to, but we shall do it. Doctor, our last segment, please. Yes. Yes, there are some good people who are following up and they want to hear the facts from you. Our last segment, myth, facts or false. Number 1, infertility is common in men with heavy weight and poor diet. True or false? in heavy now the current information we have is that is true. Yes, people who are heavier in weight than men have lower reproductive potential in terms of not only their ability to perform sex, but also their quality of sperms are low in terms of numbers. They also, we now know they have problems with the hormone balancing. So that is true, and it's a very current information. Thank you so much. Yep. Men who sit for long, like drivers, pilots, and cyclists, are likely to become infertile. True or false? Thank you so much. Diseases like pressure, diabetes can cause infertility. True or false? Thank you so much. Heavy workout and exercises can cause male infertility. You talked about this. Yes, that is very true. 100%. Male infertility is hereditary. True or false?
Some of them.
Some of them.
Yeah.
Tight boxers can cause infertility too. True or
True.
false? Thank you so much, doctor. I think you're seeing the percentage. Thank you. Heat and vibrations from phones and laptops can cause infertility in men, especially when they're put in pockets. True or false, doctor?
Very, very true.
Very good. This is 10 out of 9 out of 10. I think you can see now where infertility originates from. This has been Medical Mind. Thank you so much for being with us.